and she holds a BSc majoring in microbiology, and she specialty of the microbiological risk assessment and food safety across the private, academia, and government sectors. And her work at Confernce, can I call Confernce, contributes to the microbiological evidence-based underpinning national standard management and strategic science work and coordination of surveillance of the national food supply. So her talk is Australian surveillance of antimicrobial resistance bacteria in retail food. So please welcome her with a big applause.
Thanks everybody, and thank you to the Korean Ministry for the opportunity to come and talk today about this work. It's exciting to, I guess, be able to talk about a surveillance project that I've been intimately involved in since its conception. So I'm going to be talking to you today about the Australian Surveillance of Antimicrobial Resistant Bacteria in Retail Food Survey Project, and I'm actually going to step you through I guess, the initial development of this program, because I think that sometimes we don't see the effort that's required to get something like this off the ground. So, thank you. First of all, just a little bit about Food Standards Australia and New Zealand. So we are an Australian statutory agency within the Australian Government Health Portfolio, and our main function is to develop and administer the Australian New Zealand Food Standards Code. And so that code is a legislative instrument, and it's given effect by our state and territory and New Zealand laws. So FSANZ doesn't do any enforcement. That is done by our state and territory jurisdictions in New Zealand, and we essentially develop the standards that they pick up into their laws, and then they enforce them. The other thing we do with other Australian and New Zealand government agencies is continuously monitor the food supply to ensure that it's safe. And so one of the ways that we do this is through a group called the Implementation Subcommittee for Food Regulation, and the particular group is the Surveillance Evidence and Analysis Working Group. So this group is essentially made up of representatives of all the different state and territory governments across Australia and then also New Zealand. And it supports the food regulatory system by implementing either binational or national surveillance and other essentially data gathering activities as well. And so the work that I'm talking about today was undertaken in collaboration with our Australian CWIG members, and it's part of the Coordinated Food Survey Plan, and that's essentially a mechanism in Australia where states and territories and sometimes New Zealand will agree to provide resources towards a particular surveillance project. So I think that the introductory talks really covered this well. I think that we all appreciate why we're here today and the global threat that I guess AMR presents. And we do see up to 10 million deaths being predicted by 2050 by certain groups. But however, the burden of illness for AMR is challenging to estimate as well, and certainly an area that we need some more efficient estimates coming from so we can make better predictions in the future. So in terms of food, so why are we interested in food? Well, food's connected and sits at the interface of humans, animals and the environment. It's considered an important driver of AMR because it can transfer not just foodborne pathogens but also commensal organisms back to humans but also back to animals as well. And it's a key part of Australia's cross-sector approach to tackling AMR. So the intention is that eventually we can have data across all of the sectors and work towards an integrated surveillance project for AMR. And also in terms of resistance, while most foodborne resistance or foodborne illness is pretty mild, there are vulnerable populations, particularly in Australia, who will need antibiotics to get better. And so that's why food agencies like Australia and ourselves need to continue to monitor the food supply in terms of AMR, but also continue our general work of driving down foodborne illness rates as well. So in terms of support for the Australian surveillance plan, this really came from our National Antimicrobial Resistance Strategy. So we have the current strategy at the moment, which is for 2020 and beyond. And so this recognises that Australia acknowledges that AMR is of national importance, affecting humans, animals and the environment and food as well. And so Confernce was funded by the Australian Department of Health and Ageing to undertake this surveillance, and it's a really good opportunity for us to advance our evidence base in Australia because we've had very limited national surveillance of AMR in food up until this point. So in terms of developing the surveillance plan, there's quite a lot of time that was involved in bringing this together. So it really started in late 2020 and we got together a antimicrobial resistance expert scientific advisory group, and essentially they provided advice back to us on what we needed to incorporate into the surveillance plan and how we were going to go forward. So Confernce also doesn't have a laboratory, so we had to undertake a procurement to outsource the laboratory component of the work, so the analysis and the AST testing. And then because of the way Australia is in its federated system, it took quite a lot of work to work with all the various state and territory governments to understand their resources and capability to be part of the work, because essentially Confernce was the coordinator and developer of the surveillance plan, and then it was our state and territory governments that actually provided the resources and people on the ground who actually went out and collected the samples. So to coordinate everybody and get them all onto a achievable and reliable plan took quite a lot of time and work. It's also, the success of any surveillance plan is really in that pre-planning as well. So we spent a lot of time making sure that we really understood everybody's capability and resources to make sure that it was going to be, that everybody was going to achieve what we were setting out to achieve by September 2022. So in terms of the initial planning, we've mentioned the codex text, and that was certainly something that we looked at and was a really great resource for the kind of information that we needed to take forward to our expert advisory group. We also referred back to the WHO integrated surveillance guidance as well, and of course had a look at the surveillance and methodologies by other international integrated plans, so DANMAP, the Canadian and US integrated surveillance projects as well. And we do have a 2007 survey that was done in Australia that we also looked at, and that represents the most comprehensive analysis of retail food in Australia prior to the project I'm talking about today. So essentially, we developed all the options, we put those to our expert advisory group. They provided advice back on all the different components. And so the components that I talk about today are those components that are outlined in the codex text that need to be considered for integrated surveillance. So in terms of the objectives, these are 4 boxes or 5 boxes that with short amount of text that actually took quite a lot of time to develop. So this was done in a consultative manner, and these weren't I guess, developed at the start. So these are really dependent on the decisions we made through the development process. And it wasn't until our kind of final meeting with the expert advisory group that these were agreed onto. And that's really because as you go along, you really need to know what kind of approach you're going to take to be able to develop achievable objectives as well. So the objectives for our surveillance were to collect contemporary nationally representative phenotypic resistance data for Salmonella, Campylobacter, Escherichia coli and Enterococcus in prioritised retail meat commodities, to collect data to identify the emergence of AMR to high importance rated antimicrobials in these bacteria, to undertake whole genome sequencing of bacteria displaying AMR phenotypes of interest and identify known resistance determinants, and to ensure our data was scientifically robust, reliable, defensible and comparable to international data and standards. So this surveillance is only for 1 year. So the other thing we wanted to do was make sure that we essentially had a foundational design that could be taken forward into an integrated monitoring scenario as Australia moves towards that as well. So the first thing we did was prioritise our food commodities. So again, this was based on Codex and WHO guidance. So the factors that we considered in doing this were the epidemiological and public health factors, consumption and production factors, where international data was also available and if commodities were represented in other surveillance systems, the potential exposure for AMR and existing data sources and data gaps, and also antimicrobial use patterns as well. And so we actually did a ranking approach with this, where we essentially did a score and we considered poultry, pork, beef, eggs, seafood, horticulture and dairy in the first round. And so poultry, pork and beef came out with the high score for this round, so they were selected. But the intention is that we will go back and look at the other commodities in future years as well. So once we had our commodities, obviously then we needed to select our key pathogens. So we considered the public health impacts of particular bacteria, but also their likely prevalence. So for those that have done food surveys before, you can spend a lot of money to look for things that are very low prevalence. And so we selected Salmonella and Campylobacter for chicken because we know that they are prevalent at not high levels, but levels where we wouldn't have to spend a lot of money to pick them up. But for pork and beef, the prevalence for those in Australia for Salmonella and Campylobacter is low. And so for these, we included E. coli and Enterococcus as the bacteria that we looked at. And that's because these are reservoirs of resistance genes, but also they are key medically important bacteria in human health as well. So a lot of work in Australia in the other sectors is looking at E. coli or Enterococcus, and so being able to link in with them was also important. And so the isolates would then go through to MICs, so micro broth dilution, and then go through to whole genome sequencing as well. And we were actually able to get all of our jurisdictions to agree to an active random sampling plan. So we did consider passive surveillance, but we were quite keen to be able to do an active sampling plan for this, particularly for this stage, but also because we didn't have data sources across the jurisdictions that would be useful in a passive surveillance. So once we had our commodities and bacteria, we then needed to determine how many bacteria we were trying to target for each food microorganism combination. And so this is really around what was affordable, but also, more importantly, what was going to provide the most reliable, robust and accurate data. And this was to achieve key objectives of estimating the prevalence of resistant isolates in a population, so it was key to our statistical analysis at the end. But then also to determine the emergence of resistance. So we were keen to be able to pick up low-level resistance in this first round as well. And so what we came up with was 200 isolates per food microorganism combination. And that also represents a value that's not too dissimilar to what other groups are doing internationally as well. So once we knew the target number of bacteria that we needed, we were then able to determine the number of food samples that we needed to collect across the nation. So because we could do multiple tests on either one chicken sample or pork sample, it was essentially based on whichever organism had the lowest prevalence. So this meant we had to collect 2,000 chicken samples, 2,000 pork samples and 1,000 beef samples across the country to be able to get 200 microbial isolates for each combination. So that meant we would have about 1,600 isolates going through to AST and whole genome sequencing at the end. So once we had that, we then needed to determine the types of samples we were going to collect and where we were going to collect them from. So we considered consumption patterns in Australia at this point, but also the prevalence of bacteria. So chicken with skin on was selected because it has a higher probability of having salmonella. And then also beef mince and pork mince were chosen. So they're fairly frequently consumed by Australians and also with a good likely prevalence of the target bacteria. We also looked at purchasing patterns and expert advice in terms of where we would actually pick these samples up from. And so we had 60% selected from large supermarkets, so that's Coles and Woolworths in Australia, 20% from small supermarkets, and then 20% from butchers that weren't within those supermarkets. And so then we had to allocate them across the country. So the advice back on this was that we should weight this by population. So on the chart there, the different population levels in Australia for our different states and territories, and that essentially represents the proportion of samples that were collected in that state or territory. So, of course, though, the other problem is that you can't randomly allocate samples across the whole state or territory. So we then had to come up with a way of limiting the range of where we were going to randomly allocate. And so we did this by choosing the greater region of our major capital cities. So we collected samples in Greater Brisbane, Greater Sydney, Greater Melbourne, Greater Hobart, Adelaide, Canberra, Perth and Darwin. And so essentially all of our jurisdictions have different, bodies and state regulatory bodies and structures in terms of how these samples were going to be collected and different resources. And that was key for us to understand as well, because you've got some fairly large differences. So out of Sydney, we had the team out there collecting 40 samples a week for 40 weeks. We did 40 weeks of sampling between September 2022 and then July 2023. But then compare that to Hobart with a much smaller population. They were only collecting 11 samples every 8 weeks, essentially. So once we had that all sorted out, we then had to randomly allocate these across these areas. And so on the graph here, I've just got an example from WA in terms of what we actually did. So with the greater metropolitan areas, for the majority of our states and territories, they then have smaller areas which are known as local government areas. And we actually can download spatial data for these, so boundaries that we were then able to upload into Google Maps and essentially then make the coloured zones that you see there. And so we made essentially 4 zones for sampling, and for the LGAs in each of those 4 zones, they were essentially the same population density. And then we gave the LGAs a random ID and essentially allocated we randomly allocated those using an online randomisation tool to various sample selections. And so what this meant was that we had a random allocation of our samples in space and not in time. So we did spread the sampling out in terms of bacteria across time quite evenly. And using this method with the downloadable boundaries, it also meant that our jurisdictions could essentially pre-plan their routes. So they were able to, because these boundaries, you can't see them on the ground, right? So how were they going to, select the shop that they were going to go to? And so what we did was provide the Google Maps to them, and they could actually search for a supermarket within that boundary. And so they could pre-allocate like have a driving route essentially of specific shops that they were going to go to. And so it allowed them to essentially pre-plan all of their driving routes before they went out. And I think that that was really useful to make sure, particularly for those that were collecting a lot of samples as well. Happy to talk more about that later because it's complex. So that's essentially all I'm going to talk about. So this just gives you an idea of where the sampling was happening, but also where the testing was undergoing. So we decided that it was really good to plan a national surveillance right at the end of COVID. And so we had quite a lot of concern that states would go into lockdown, that our perishable samples might get stuck in transport, and so we did want to, we decided it was important to have laboratories close by to do the presence-absence testing of the bacteria, and so the red dots are where those laboratories were, and then all the bacteria that were isolated were then shipped across to Murdoch University. Murdoch University's got a robotic system for doing antimicrobial susceptibility testing, and they also did the whole genome sequencing. So, and I guess apart from having a really excellent baseline for antimicrobial resistance in these commodities, we're really hopeful that this data will be able to contribute to other things such as microbiological risk assessment and exposure assessments, and analysing trends, contributing to future source attribution, being integrated into future surveillance as well, and helping us to have better policies, risk analysis and recommendations for antimicrobial use in Australia. And finally, just to acknowledge that I'm one person of a whole lot of people that was involved in this work. And so as of July 2023, our sampling was hugely successful. It could not have gone better. And that's really a credit to all of our state and territory jurisdictions that were involved, from New South Wales, Victoria, Queensland, WA, South Australia, Tasmania, NT and the ACT. And of course I can't forget the Australian Government Department of Health and Ageing, our expert scientific advisory panel, our laboratory collaborators, and also all the staff at Confernce. So that's it. Thank you very much.